Well, clearly the CQC report was very disappointing for the Trust, and the CQC had identified a number of areas of patient safety and leadership where we needed to improve. And in particular, I would say, in terms of sepsis management, some of our governance systems weren't adequate, and clearly because of the instability in previous leadership, that was a problem that the CQC wanted to see addressed.
We're working really hard at the moment on improving our communication between team members, the formal and informal communication that we have for handover to support patient safety and patient care.
I think that the majority of every area in the hospital have improved. I think staff have become more focused on what needs to be done.
So since December 2015, quite a few changes have been made. The orthogeriatric service wasn't running very well. One of the big changes they made was they employed an extra doctor on the medical side of things to look after the frail elderly patients who've fallen and broken their hips.
Over the last 9 months is the fact that we are now a protected ring-fence elective ward, which means that we can ensure we give specialist care to the elective patients on that pathway.
Since the CQC report in 2015, patients have provided some real valuable feedback and on the whole very positive about the improvements to our services, and that applies to relatives as well who often engage with our services, and they've been reassuring us that the quality of our care is what we expect to the high standards.
This has been a landmark year for this Trust. Things started with the CQC report from 2015. As a result of the CQC report, I think the real positive that's come out of this is staff responded fantastically. It's been a difficult few years for staff in this Trust, but when they got that report, there was a real sense of energy and urgency to deal with the issues.
Going forward, we are going to be working closely with our partners across the East Midlands in both primary and secondary care to continue to improve the treatment of sepsis.
So down at MCH in 2015, when the CQC report came out, I think we expected the overall report to be quite positive. I think moving forward over the last year, we've come a long way. We've done lots of things on the sepsis, deteriorating patient, documentation, and things are improving. We've still got a way to go, but we're getting there. Staff morale's improved, vacancies are improving.
We took the report in hand. We looked at how to improve things. We've had some help from strategy improvement on the ward, looked at patient flow from ED to the ward, and made some developments on that.
If we reflect on where we are now, we've massively improved some of the processes and structures of the Trust. There's been a real change in engagement from staff. There's a real can-do, want-to-do attitude now.
I'm proud of working on Ward 11 and being part of the Trust because I enjoy being part of a professional team and delivering excellent patient care.
I enjoy lots of things about working here, and I came here as a trainee 2 years ago and chose to stay an extra 2 years. That wouldn't be normal for my stage of training. It's the friendliest hospital I've worked in, and as a consequence I think lots of good things have changed since I started here, partly I guess inspired by the CQC inspection, but instead of it becoming a negative thing, I think everyone has to be very positive about it, and I think I've seen lots of things improve since I started here, and I just feel happy. I'm the happiest working here of the other 4 trusts I've worked in, so I think that speaks for itself.
I think the partnership with NUH has been very helpful for us in terms of sustainability. It's allowed us to deal with a number of issues which as a standalone organisation we may have struggled to deal with in that time frame. So developing that partnership working, because again what's underlying that is the right things for patients.
Among our key priorities is to continue the partnership with Nottingham University Hospitals. We clearly both face a challenging winter. We're going to, however, still focus on developing our joint clinical pathways, maybe some joint medical appointments, and start to align our systems and process with where appropriate during that period in preparation for a merger sometime in 2017. Well, clearly we've got much still to do. We are not going to be complacent. We've got to a good position in terms of hopefully in terms of our quality outcomes, We need to build on that, and we have now a comprehensive quality improvement programme for the next 6 months, and we clearly still need to build a stable leadership team in the organisation. So I think they're the key priorities for the immediate future.